Victor Echevarria. I'm with a firm called Jackson Square Ventures. We're an early stage venture capital firm based in San Francisco. We invest primarily in SaaS and marketplace companies in industries that we would consider non-consensus. So we don't look for trends. We don't follow where all the hype is headed. We like to find entrepreneurs with passion building companies that will be, category leading, standalone at scale public companies in 20 years. We're not looking for a quick flip. We are industry agnostic. Outside of that, we've done everything from legal technology, marketing technology, fitness, and my focus is mostly on healthcare, digital health, and fintech. So Jackson Square Ventures, we're on our third fund. Our fund that we're investing out of currently is about 193 million. Our check sizes tend to be 3 to 7 million. We always like to lead. We always take board seats. Like I said, we're in it for the long haul, and we're all former entrepreneurs and operators. So we want to be the VCs we would have wanted to work with in our prior lives. So hopefully that's a feature with the entrepreneurs with whom we work. The rounds that we participate in can be seed, can all the way to Series B. Most of what we do tends to be Series A, these sort of $8 to $10 million rounds where we take the majority of it, but we leave plenty of room to make sure that we have the right people around the table. We're not the kind of firm that must have the entire round. We're also not the kind of firm that stops showing up to board meetings or tries to kill the company when things go sideways. We know what it takes to build a successful company, and we're going to be there to support the company as it grows and experiences speed bumps. Interestingly enough, the last year, I think in a lot of industries has been a great accelerant of trends that have long been forming. I think in digital health in particular, you're seeing that emphatically. We've seen a lot of interest. We can talk about the trends in venture financing in general later down the road, but I would say specifically within digital health, we're seeing institutions that were very resistant to change, scrambling to adopt change very quickly. So what has historically been an industry that has been very difficult in which to innovate, we're now seeing entrepreneurs have much more success in building tremendously sustainable businesses in collaboration with health systems, insurance companies, and pharma companies. In digital health, everything is focused, I think, on two major aspects, and I think it's kind of mirrored in the broader innovation ecosystem. Everything's focused on how to engage patients outside of the four walls of a doctor's office or a hospital. So what used to be, when a health system previously would adopt technology, or the limitation of what they would adopt be an EHR, electronic health record system, old, antiquated, in-house, on-prem software that's clunky and difficult to use. Now you're seeing third-party software vendors come in promising to help these health systems and doctors' offices to meet patients where they are. Telemedicine, I think, is kind of at the hub of all of this. You're seeing companies like Teladoc exploding in value just because their engagement with patients is no longer a nice to have, but it's a must have. Health systems in general, I think, are finding every way possible to engage patients at home, encouraging people to engage with their doctors at home, whether it's through an official platform like a Teladoc or even informally with Zoom. I mean, my kid's pediatrician now does as many visits as possible just over Zoom. There's no specific healthcare technology platform, just any way possible to engage individuals at home. But that's general purpose. So, that's the synchronous touch point with a physician. Healthcare involves, a myriad other features and use cases that you need to enable with technology. So now we're seeing remote patient monitoring technologies take flight. Asynchronous communications, I think, is very important as the industry grows, just because it's no longer feasible to just pick up the phone and expect someone to answer on the other end, especially as more patients are staying home. We're seeing much more in the field of data interoperability, especially as health systems want to have more of an impact on the health of an individual. They need to find and collect insights based on data, not just from their own experience with the patient, but from a patient's entire healthcare journey. It's very difficult to do in a world where most data is transmitted over fax machines and snail mail. So health data interoperability is a big trend that we're starting to see. and a lot of direct to consumer unbundled healthcare programs. I think it started with Hims and Row and has ultimately expanded to many more use cases. You have lots in mental health. You have verticals like hypothyroidism with Paloma. Um, you have companies like Alto Pharmacy that are bringing medicines to people's doorsteps as opposed to making them go to pharmacies. You have companies like Brightside that are focused on mental health. Um, you've got companies like Plume or Folks Health that are focused on LGBTQ and gender affirming hormone therapy. So there are lots of verticals that are splitting out. It's not just these. You're starting to see a lot of these vertical healthcare solutions take flight primarily because they're hyper targeted towards individual populations that have been poorly served by technology in the past.